Hello, Riverside County. Today, I want to walk you through California's Behavioral Health Transformation and the Behavioral Health Services Act, or BHSA. You'll hear me say BHSA throughout the presentation, since that's the short way we refer to it. What we'll cover today is important because it affects not only our department, but every resident of Riverside County. I'll explain how BHSA changes the way behavioral health services are funded, what new requirements counties like ours must follow, and most importantly, how you, as community members, providers, and partners, can be part of shaping Riverside County's BHSA plan through your feedback. California is undergoing one of the most significant changes to healthcare we've seen in decades, especially in mental health and substance use services. This effort is called Behavioral Health Transformation, or BHT. The main idea behind BHT is to stop making people navigate the system on their own. Instead, prevention, treatment, and recovery services should be connected, working together like parts of one system. A major piece of BHT is the Behavioral Health Services Act, or BHSA, which voters approved through Proposition 1 in March 2024. Prop 1 did two big things. It invested $6.4 billion into treatment centers, residential facilities, and supportive housing for people experiencing serious mental health or substance use challenges. It modernized the old Mental Health Services Act, renaming it BHSA, and expanded what services can be covered. BHSA makes several important shifts. It now includes services for people whose main challenge is substance use, not only mental health. It directs counties to focus on people who are homeless, under conservatorship, or involved with the justice system, and it requires counties to prioritize Medi-Cal members to ensure those eligible receive all the services they're entitled to. BHSA also allows funding for a more complete system of care, services that connect across programs so that people don't fall through the cracks. The goals are straightforward: expand access to care, hold counties accountable for results, and increase housing and facility options across California. And BHSA is not alone. It's connected to other big efforts, like the Children and Youth Behavioral Health Initiative, or CYBHI, which brings services into schools and youth programs. Payment reform, which ensures counties make the most of Medi-Cal dollars. Care Court, which provides court-supervised treatment and housing support. And an expansion of proven practices like assertive community treatment, coordinated specialty care for first episode psychosis, high-fidelity wraparound, and more. Behavioral health transformation is built on a simple vision: make behavioral health services work more like the rest of healthcare. Think about how most people enter healthcare. You usually don't start with a specialist. You see your primary care provider first. Under California's redesign, county behavioral health departments are being defined as specialty care. That means managed care plans and their provider networks, including primary care, will be responsible for prevention and for serving people with mild to moderate needs. County behavioral health, funded by BHSA, will focus on individuals with the most serious challenges, people who need specialty care and ongoing support. This redesign is meant to ensure BHSA funds aren't paying for services that insurance or Medi-Cal already cover. It expands access for those who need the most help, while making sure public dollars are used more effectively across the entire health system. In short, California is restructuring its system so behavioral health fits into the broader healthcare landscape, specialty care where it's most needed, and prevention and mild needs handled through other community systems. Under BHSA, every county must cover the full continuum of care. This means services ranging from early intervention to intensive treatment and recovery supports. The State Department of Healthcare Services created this continuum to ensure that people don't get stuck at just one level of care. The idea is that no matter where someone enters the system, whether in a crisis, through outpatient care, or while transitioning from homelessness, they can move to the right level of support at the right time. Counties must now include all parts of this continuum in their integrated plans, except for primary prevention. Prevention will now be handled by the California Department of Public Health and other systems like schools and community health programs. Importantly, integrated plans must cover all services delivered by county behavioral health, no matter what funding source is used. This creates a complete picture for the state and the public, showing not just what programs exist, but how they connect and how they're funded. Proposition 1 isn't just about changing how services are delivered. It also brings real funding to expand the places where care happens. Through the Behavioral Health Continuum Infrastructure Program, or BCHIP, Riverside County applied for and was awarded significant bond dollars. This funding is dedicated to building more treatment centers, residential facilities, and supportive housing across California. For Riverside County, these dollars translate into two major projects. The first is a brand new psychiatric hospital and wellness center at the RUHS Medical Center campus in Moreno Valley. The second is a children and youth campus in Beaumont, located right next to Harmony Haven. Both of these projects represent long-term investments. They will expand our ability to provide services, not just for today, but for generations of Riverside County residents to come. BHSA changes what counties are required to do. First, counties must now serve people with substance use disorders, not just those with mental health conditions. That's a major shift, since it broadens the entire population we serve. Second, BHSA prioritizes services for people most at risk of falling through the cracks, those experiencing homelessness, people under conservatorship, and individuals involved in the justice system. Third, counties must focus on Medi-Cal members, ensuring that those eligible are connected to services they're entitled to. These requirements reshape how local dollars are spent and create new opportunities to align with healthcare providers, law enforcement, housing partners, and community organizations so people receive more complete and connected care. One of the biggest changes under BHSA is the way primary prevention is handled. Counties will no longer use BHSA funds for broad prevention programs. Prevention funds have been allocated to the California Department of Public Health for population-based prevention programming. Additional prevention efforts will be supported by other state initiatives like CYBHI. But that doesn't mean prevention is less important. It just means the responsibility shifts. Schools, pediatric settings, and community organizations will take the lead, while county behavioral health departments will focus resources on individuals already experiencing serious challenges. For families and community groups, this distinction is important. Prevention is still a priority, but it won't be funded or led directly through county behavioral health anymore. As a result, Riverside County programs that no longer meet BHSA regulation will sunset June 30, 2026. This includes stigma reduction programs, mental health awareness activities, parenting, family, and other support programs focused on non-specialty mental health or non-Medi-Cal community members, and Suicide Prevention Coalition activities. Under the Behavioral Health Services Act, counties are now required to provide a core set of services. That starts with outpatient and field-based care for people who have the highest needs, meeting them where they are, whether that's in a clinic or out in the community. It also includes substance use disorder treatment. And importantly, this covers people whose primary challenge is addiction, not just those with co-occurring conditions. For individuals who are justice involved, such as people coming back into the community from jail or probation, the law requires services designed specifically to support that transition. And finally, housing and residential services must be part of the system. That way, treatment doesn't get interrupted when someone loses stable housing. A key point here is that many of these services must follow evidence-based models. That means they're not just well-intentioned programs. They're approaches that have been tested, studied, and shown to work in helping people recover. Perhaps the biggest change for counties is how planning works. Previously, counties had to create multiple separate plans, one for the Mental Health Services Act, another for substance use services, and another for Medi-Cal programs. Now, under BHSA, everything is combined into one integrated plan. This plan must cover all behavioral health services, no matter the funding source. That makes planning more transparent, reduces silos, and makes it easier to show how different services fit together into one system of care. For Riverside County, this means every BHSA-funded program will be visible within a larger picture of how we deliver behavioral health services as a whole. California is making it clear. Counties have to use evidence-based practices under the Behavioral Health Services Act. These are approaches backed by strong research, proven to help people recover and stay well. Some of the required practices include assertive community treatment, or ACT, and forensic assertive community treatment, FACT. These are intensive, team-based approaches for people living with serious mental illness, including many who are also connected to the justice system. High-fidelity wraparound. This is a structured way of coordinating care for children and families who have very complex needs, making sure everyone involved is working from the same plan. Coordinated specialty care, or CSC. This model focuses on early intervention for young people experiencing their very first episode of psychosis, giving them treatment and support right away before the condition worsens. Individual placement and supports, IPS. This is a supported employment model that helps people with behavioral health challenges find and keep competitive jobs, not just sheltered work. Assertive field-based initiation of substance use disorder treatment. This means meeting people exactly where they are, in the community, in shelters, sometimes even on the street, and starting treatment for addiction immediately. For counties, the bottom line is this. BHSA funding can't just go to any program. It has to go to programs that meet these evidence-based standards, ensuring that public dollars are invested in strategies that truly make a difference. The Behavioral Health Services Act also changes how funds are divided. In the past, there were 5 categories. Now it's been simplified into 3 main areas for counties, plus a state share. 90% of the funding goes directly to counties. Of that amount, housing interventions make up 30%. This ensures people have stable places to live while they recover. Full-service partnerships, or FSPs, receive 35%. These are intensive wraparound programs for people with the highest needs, offering support on nearly every front. Behavioral health services and supports get the other 35%. Half of this is dedicated to early intervention. The other half covers outpatient care, field-based services, and other treatment supports that people rely on every day. The remaining 10% stays at the state level. That money doesn't go to counties. Instead, it funds statewide population-based prevention programming, oversight, equity initiatives, innovation, and evaluation. In short, it makes sure counties are not only funded, but also supported and held accountable to deliver services fairly and effectively. By moving from 5 categories to 3 main buckets, plus the state portion, the funding's much easier to follow. It shows clearly where the money's going and ensures the biggest priorities, housing, FSPs, and treatment, are fully resourced. People cannot focus on recovery if they're living on the streets or constantly moving from place to place. Under BHSA, 30% of the county funds go directly to housing-related interventions. This can include rental assistance, housing navigation, supportive housing programs, or temporary placements that help people stabilize while receiving treatment. The goal is to reduce homelessness and ensure that behavioral health services are not interrupted because someone doesn't have a place to live. Full-service partnerships, or FSPs, have always been a cornerstone of MHSA, and now BHSA places even greater emphasis on them. FSPs are designed for individuals with the highest needs, people with serious mental health or substance use conditions who need intensive, ongoing support. These programs provide wraparound services, including treatment, housing help, employment support, and peer involvement. With 35% of the county's BHSA funds dedicated to FSPs, counties are expected to strengthen these programs and ensure that people with the most complex challenges are not left behind. The final 35% of BHSA county funding supports a wide range of services. This includes early intervention, outpatient therapy, crisis response, substance use treatment, peer support, and other forms of ongoing care. The idea is that while housing and FSPs are critical, many people benefit from services that aren't as intensive, but are still essential for recovery. This funding category ensures those supports remain strong and accessible. Early intervention is a key piece of the behavioral health services and supports bucket. This is where half of that 35% is focused. In Riverside County, this does not mean fewer services. In fact, many of the programs people know and rely on will continue, and we'll also be adding some new evidence-based practices required under BHSA. From our Prevention and Early Intervention Plan, programs like Mamas y Bebés, the Inland SoCal Crisis and Suicide Helpline, Cognitive Behavioral Therapy for Late Life Depression, the PEARLS program, CBITS in schools, Bounce Back, and Stress in Your Mood will continue under early intervention. Programs like Seeking Safety and Parent-Child Interaction Therapy for young children will also remain. On top of that, the state now requires certain evidence-based practices to expand our system of care. That includes functional family therapy, multisystemic therapy, and more PCIT or parent-child interaction therapy. These additions strengthen our outpatient system and give families more proven tools to support recovery and wellness. Another important change is that coordinated specialty care for first episode psychosis, or CSC-FEP, is now required under BHSA. Riverside already has this program in place with grant funding, and it will continue. CSC is a team-based approach that helps people who are experiencing the very early stages of psychosis. It's one of the most evidence-supported interventions available, and it's been shown to reduce hospitalizations, emergency room visits, and the other disruptions that often happen when psychosis goes untreated. Finally, all intervention providers will need to meet new Medi-Cal certification requirements. This ensures quality, accountability, and access to federal reimbursement. We know some providers may choose not to continue, so our team's working closely with partners to support compliance or identify alternatives. The bottom line is this: early intervention under BHSA keeps the programs that work, adds new proven treatments, and ensures consistent quality. This helps people get care earlier, prevents crises, and improves long-term outcomes. So with early intervention, we're keeping many of the programs people already know, adding new proven practices, and strengthening the quality of services across the board. All of this makes sure people get help sooner and have better long-term outcomes. Now let's look at that remaining 10% of BHSA funding, which stays at the state level. The remaining 10% of BHSA funding doesn't go to counties. Instead, it stays at the state level. This money has three main purposes: oversight and accountability at 3%. The state uses this share to track outcomes, monitor equity, and make sure counties are delivering on the goals of BHSA. Workforce at 3%. Another part is dedicated to building the behavioral health workforce. That means more training programs, better pipelines into the field, and efforts to recruit and keep qualified staff. And prevention and innovation at 4%. The last share is focused on prevention and innovation. This includes statewide prevention campaigns, piloting new approaches, and creating tools that can be shared across all counties. So while most of the money goes directly to counties, the state's 10% plays an important role. It ensures that there's consistency across California, that the workforce is supported, and that new and better ways of providing care are always being tested. BHSA places new requirements on counties to show results. The state wants clear data on how many people are served, what outcomes are achieved, and whether funds are used as intended. Counties must track performance and report regularly. Plans and outcomes must also be shared with the public, so communities can see exactly how dollars are being spent and what impact they're having. This is about trust that public dollars are being used effectively and trust that services are truly reaching those who need them most. Counties must now submit a single integrated plan that covers all behavioral health services. This replaces the old system of multiple separate plans and makes county planning more transparent. It also helps the state and community see how services connect across funding streams, including Medi-Cal, BHSA, and other sources. Integrated planning is meant to break down silos and show a complete picture of the behavioral health system in each county. BHSA also requires county behavioral health to collaborate with our local health jurisdiction, which is RUHS Public Health, on the Community Health Assessment, or CHA, and their Community Health Improvement Plan, CHIP, for both engagement with community members and sharing local data to determine gaps and needs for services. Community voices are central to BHSA planning. Counties must actively seek input from consumers, families, providers, and community partners. This engagement isn't just for show. The feedback directly shapes the integrated plan. By law, counties must hold public hearings, invite written comments, and demonstrate how community input is used to shape final decisions. This is where your voice comes in. As community members, you have the opportunity to provide feedback about how BHSA funds are used in Riverside County. We are currently in the transition period from MHSA to BHSA. This means the county's phasing out old structures and replacing them with new requirements. During this time, it's important to stay flexible. Programs may be adjusted, funding may shift, and planning processes will evolve. The goal is to ensure a smooth transition so services aren't disrupted and communities continue to receive support while the new system is put into place. The Behavioral Health Continuum Infrastructure Program, or BCHIP, is the funding structure that Proposition 1 uses to distribute bond dollars. The goal of BCHIP is to expand the types of facilities available for behavioral health treatment. This means building or upgrading residential care centers, treatment facilities, crisis stabilization units, and supportive housing. For too long, California has had gaps in the system. People in crisis end up in emergency rooms or jails instead of in appropriate treatment. BCHIP funding helps close those gaps by creating spaces designed for care, recovery, and long-term stability. With BCHIP funding, California plans to add thousands of new treatment beds and supportive housing units. This includes facilities for people with serious mental illness, substance use disorders, and those experiencing homelessness. It also means investing in youth-focused programs and facilities that support children and families. The goal is not just to build more buildings, but to create a full continuum of care so people can step into the right level of support when they need it, whether that's short-term crisis care or long-term housing. Payment reform is another key piece of behavioral health transformation. Historically, counties relied heavily on MHSA dollars to fund services, but many of those services could also be billed to Medi-Cal. The state is pushing counties to maximize Medi-Cal billing. This ensures that services eligible for reimbursement are billed through Medi-Cal first, freeing BHSA funds to cover services and supports that Medi-Cal doesn't. The result is a smarter, more efficient use of resources. It also means that more individuals who qualify for Medi-Cal can get their services covered without straining county budgets. Care Court, which stands for Community Assistance, Recovery, and Empowerment Court, is a new program in California that connects people with serious mental illness to court-partnered care plans. The goal is to help individuals who are often cycling through jails, hospitals, and homelessness access treatment before they hit crisis points. Counties will be able to use BHSA funds to help implement Care Court programs, providing clinical services, housing supports, and case management. This is part of the state's broader push to make sure the most vulnerable residents, those who cannot access or stay connected to care on their own, get the help that they need. The Children and Youth Behavioral Health Initiative, or CYBHI, is another major statewide investment that connects directly with the Behavioral Health Services Act. Its focus is on building the infrastructure kids and teens need to access care, whether that's in schools, pediatric clinics, community centers, or even online platforms. The idea is prevention, reaching children early, giving them support before challenges grow into full crises. CYBHI and BHSA are meant to work hand in hand. CYBHI builds the access points, creating the front doors where young people can find help. BHSA provides the long-term funding and accountability structure to keep those services going and make sure they deliver real results. BH Connect is a statewide effort designed to make sure counties use evidence-based practices consistently across programs. It ties directly into the Behavioral Health Services Act by requiring specific, proven models. One of these models is Assertive Community Treatment, or ACT, along with its justice-focused version, Forensic Assertive Community Treatment, or FACT. These are intensive, team-based approaches that bring treatment to people in the community. They're especially effective for individuals living with serious mental illness, including those who have contact with the justice system. Another is individual placement and support, or IPS. This model focuses on supported employment. It helps people with behavioral health needs not only get a job, but keep it, because work is often a key part of recovery and stability. The third model is Coordinated Specialty Care, or CSC. This program provides early and specialized treatment for individuals experiencing their first episode of psychosis. Getting the right care early makes a huge difference in long-term outcomes. In addition, BH Connect requires counties to expand services for children, youth, and families through 4 well-established models. Parent-Child Interaction Therapy, or PCIT, strengthens healthy relationships between parents and young children. Functional Family Therapy, or FFT, helps parents improve communication and reduce conflict. And Multisystemic Therapy, or MST, is designed for youth with more complex behavioral health needs, supporting them in the home, school, and community. And High Fidelity Wraparound, or HFW, is a family-driven process that builds a strong support team around youth with the most intensive needs. The purpose of BH Connect is to ensure that whether you live in Riverside, San Diego, or Sacramento, you can expect access to these proven and effective services. It also builds in accountability by tracking outcomes statewide so leaders can see what's working and make adjustments when needed. BHSA emphasizes a system of care approach. This means services are not delivered in isolation. Instead, care is coordinated across housing, health, behavioral health, social services, and justice systems. For individuals, this makes the experience less fragmented. They don't have to retell their story to every new provider. For counties, it increases efficiency and ensures that resources are shared. The system of care approach recognizes that recovery is not just about treatment, it's about addressing all the factors that support wellness. The Behavioral Health Services Act is very clear about who we need to serve first. Funding is directed toward the people who face the biggest barriers to care. That means first, people experiencing homelessness, those who need immediate support, whether it's help with housing, benefits, or connection to treatment. Second, individuals under conservatorship who require careful coordination, including medication support, step-down services, and stabilization. Third, system-involved individuals. These are people connected to justice or child welfare systems who often face complex, overlapping challenges that make it hard to stay connected to care. And finally, Medi-Cal members, because this is California's safety net, and it's critical that public coverage comes with strong behavioral health services. By naming these groups directly, the state's making sure that resources reach the people most likely to fall through the cracks and most in need of consistent support. One of the biggest changes with BHSA is the focus on data. Counties must provide measurable outcomes, not just activity reports. This includes tracking how many people are served, what services they receive, and how outcomes improve over time. The state will use this data to evaluate performance, share best practices, and ensure equity across counties. For communities, this means greater transparency and the ability to hold counties accountable for delivering results. The state recognizes that not all communities have had the same access to care. BHSA requires counties to demonstrate how they're reducing disparities, particularly for racial and ethnic minorities, rural residents, LGBTQ+ communities, and others who've historically been underserved. The vision is that every Californian, no matter who they are or where they live, should have access to quality behavioral health care. Recovery in behavioral health doesn't happen in one office or one clinic. It happens when healthcare, housing, social services, and justice systems are all moving in the same direction. In practice, that looks like primary care and hospitals doing more than just writing a referral. They screen, make a warm handoff, and follow up. So getting referred to behavioral health is the start of coordinated care, not the end of the story. It means mental health and substance use teams planning together for people with both needs. That way, treatment isn't split into 2 separate, disconnected paths. It means homeless services, shelters, and supportive housing providers working side by side with clinical teams. A treatment plan shouldn't fall apart just because someone changes locations. And it means probation officers, courts, and reentry programs staying linked with clinical teams so people returning to the community get the support they need and don't end up back in custody. When these partners share information, align their timelines, and hold each other accountable, people stop falling through the cracks and instead start building real, lasting stability. Counties remain the backbone of California's public behavioral health system. The Behavioral Health Services Act keeps that local flexibility in place, but it also adds new clarity and accountability. Counties still design services that reflect their local needs, but they now have to show exactly how those services are reaching priority populations. The state's role is to set the standards, review county plans, and monitor how well the system is performing. Public reporting isn't optional anymore. It's at the center of this transformation. Data on access, quality, and outcomes will be published in plain language so that communities can see how the system's working. This balance is important. It preserves the ability for counties to build solutions that make sense for their communities while ensuring statewide consistency and real transparency for the public. To make the Behavioral Health Services Act work, we need three things: people, tools, and places to deliver care. Under the category of behavioral health services and supports, counties have the flexibility to strengthen both the workforce and the infrastructure. On the workforce side, this means investing in education and training programs. We need to recruit and retain not just clinicians, but also peers with lived experience and bilingual or bicultural staff who can connect with diverse communities. It also includes building up clinical supervision capacity so new staff are well supported and making sure everyone is trained in evidence-based practices that really work. On the infrastructure side, it's about capital facilities and technology. That means modernizing our clinics, expanding telehealth, building e-consult tools so providers can connect quickly, and increasing mobile outreach capacity. It also means upgrading our data systems so care is coordinated and outcomes are measured in real time. These investments do more than just expand capacity. They raise the quality of care, improve access for communities that have historically struggled to connect, and ensure equity across the entire behavioral health system. Accountability is at the center of the Behavioral Health Services Act. It all comes together in what's called the Behavioral Health Outcomes, Accountability, and Transparency Report, or BODR. Every year, counties are required to show clearly how funds are being used, who is being served, and what impact the programs are having. First, counties must report on spending. That means breaking down how funds are used across the three major components: housing interventions, full-service partnerships, and behavioral health services and supports. Second, counties share who was served. This includes reporting by eligibility and priority population, so we know whether funds are reaching the people who were intended to benefit most. And third, counties explain what actually changed as a result of services. Did people gain housing stability? Were they connected to outpatient care? Did we see fewer emergency room visits or hospitalizations? Did more people engage in substance use treatment, find employment, or continue in education? And finally, counties report on workforce progress. This covers hiring and retention, language capacity to meet diverse community needs, and the level of training staff are receiving. Together, these reporting requirements create a transparent system where we can track progress, measure outcomes, and hold ourselves accountable to the people we serve. BHSA calls out specific groups because they face the highest barriers. What does service actually look like for them? For people experiencing homelessness, we start by meeting them where they are, out in the community. Right away, they get a same-day clinical and benefit screening. From there, we help with housing navigation or place them in interim housing. The goal is to quickly connect them to a full-service partnership or outpatient care, while also providing the ongoing support they need to keep their housing. For individuals under conservatorship, the focus is on planning ahead before discharge. We work on a smooth step down into the least restrictive setting possible. Along the way, we make sure they have medication support, psychosocial rehabilitation, and peer services to help them stabilize in housing and in life. For justice-involved individuals, we don't wait until release. Engagement starts inside within reach before day one back in the community. Their care plan is ready to go the moment they step out. We fast-track access to assertive community treatment and housing. Warm handoffs ensure they're connected immediately to outpatient care. For Medi-Cal members, the first step is always to maximize the benefits Medi-Cal already covers. Then, if there are gaps, BHSA funding can fill those in. This ensures people receive continuous, comprehensive care without interruption. The transition to the Behavioral Health Services Act isn't happening all at once. It's phased carefully so that people don't lose services and counties have time to adjust. In 2024, California voters approved Proposition 1. That vote set everything in motion. Right after the state began early planning and issuing guidance so counties could prepare. In 2025, counties are tasked with creating and submitting an integrated plan. This plan brings together all behavioral health services and funding streams under one umbrella. At the same time, counties begin ramping up the use of evidence-based practices to meet new state requirements. By July 1, 2026, the most significant shift takes place. Funding begins flowing through the new BHSA structure with set percentages dedicated to housing, full-service partnerships, and behavioral health services and supports. The state also begins directing prevention funding, and any programs that don't meet BHSA criteria will either transition or close. Between 2026 and 2027, the system reaches full implementation. That means counties are now producing full annual outcome reports through the BODR, workforce expansion strategies are in motion, and facility projects are moving from the planning stage into actual operation. Through all of this, the state emphasizes 3 things. There should be no disruption in services. Counties must maintain clear communication with communities and partners, and every step should stay aligned with the new BHSA requirements. Community input isn't just a box to check. It's what shapes the final plan. There are several ways people can make their voices heard. The integrated plan must be completed every 3 years along with a community stakeholder planning process. First, there's the 30-day public posting. The draft integrated plan will be posted online for public comment in the first quarter of the calendar year. During that full posting period, anyone can submit feedback electronically. Second, the public hearings. The Behavioral Health Commission will host in-person hearings where people can come and share directly. For those who can't attend in person, a virtual hearing series will also be available in English, Spanish, and American Sign Language. Those recordings will stay up for 3 weeks, so people can participate on their own time. Third, there are multiple ways to give feedback. You can submit comments online, or if that's easier, you can call and leave a message on the public hearing voicemail line. Every single comment is reviewed, and when the final plan is released, it includes a changes log that shows exactly what was updated in response to community input. That way, people can see how their feedback made a real difference. Community feedback has already reshaped our system. Years ago, crisis response was largely limited to the psychiatric emergency room and law enforcement. Residents asked for more options, and now we have a broader crisis system of care. Mobile response, walk-in access, stabilization, and stronger handoffs to outpatient and housing supports. The message is simple. Informed, specific feedback moves resources. Use it. California is investing in a behavioral health system that is accessible, accountable, and equitable, with housing as a foundation and proven practices at the core. In Riverside County, your partnership ensures these reforms fit our community, that services are culturally responsive, that people can access care and when and where they need it, and that we can point to results that matter: stable housing, improved health, and real recovery. Thank you for your time, your advocacy, and your commitment to a healthier Riverside County.